Welcome to Care More, Be Better, a podcast for people like you who care about the social impact of conscious companies and everyday heroes. Hear inspiring stories from those who put people and planet before profit and personal gain. You'll learn how you can make a difference, vote with your dollars, and get involved today. Here's your host, Bellizzi.
In this week's bonus episode, I'm walking you back in time to episode number 6, when I interviewed my father-in-law about the not-for-profit patient advocacy foundation that he created 26 years ago, the Corneal Dystrophy Foundation. Robert Bellizzi, who everyone called Bob, passed away quietly at home on April 8th, 2024, only 5 days before he would have turned 93. Now, Bob was an incredible, charismatic, purposeful, and giving person. He never really retired, as he gave just so very much of himself to the patients that he served. If I were to choose one word to describe Bob professionally, it would be that: service. He lived in service to other people who battled the rare diseases lumped under the term corneal dystrophy. His life was, of course, more than that. He was a lifetime technologist who worked with IBM in the early days, joking that IBM stood for, "I've been moved." That's what brought him from the East Coast to San Jose before my husband was born back in 1967, the youngest of 3. Bob was a dedicated, sometimes strict, and also loving father. His boys called him affectionately Papa. My boys called him simply Grandpa. I will, of course, miss Bob. I will miss his stories, his irreverent and sometimes inappropriate sense of humor, his smile, and his passion. I frankly feel so lucky to have had the opportunity to understand who he was professionally and personally, and to have preserved his voice and some of those stories on this very podcast. I hope you'll listen and perhaps follow Bob's simple advice to get your eyes checked if you haven't in a while. Because you know what? You'll never know what you'll learn, and it may just be the tool that helps you prevent further decline in some area of your health that you hadn't looked at recently. With that, here's Bob.
Thank you for having me.
Bob, why don't you tell the story of what it was like for you to be diagnosed with Fuchs dystrophy before a patient platform like that existed, like Fuchs Friends? And how did you feel being diagnosed with this rare genetic disease?
Well, I'm kind of strange as far as my professional history went. I bridged the gap between hardware engineering and software. I did a lot of consulting where I had to analyze people's logic diagrams to decide what to do with it. I started to notice that they were giving me ever more poor Xerox copies. At least that's what I thought. I would have to get my sons to look at the logic. Okay, so I finally got back to my optometrist, and he said, "Well, you have cataracts, and I want you to go to this ophthalmologist, and he'll take care of the cataracts." Well, the ophthalmologist was quite upset when he took some measurements, and he said, "Go home, I'll call you later. I have to do some work here first." And it was really strange. Well, he called me and said, "You have something, a rare disease called Fuchs corneal dystrophy," and that's like Fox in German, Fuchs. And he said, "There's only one place within this area, and that's the University of California, San Francisco. And I've got you hooked up with them for an appointment." Being a geek all my life, I dug into the internet. Mind you, this was 1998, so there wasn't much there. And there were only
no Google.
Yeah. Well, Google didn't exist at that point online. Yahoo was the big baby. And there were only 2 places, Washington University in St. Louis and UCSF, that had any identifiable information. And since I was on a slow connection, I set up to print out everything and went to bed. The next morning, I had about 90 sheets of paper, and I started reading on it.
Now, I imagine those 90 sheets of paper might have also looked like poorly Xeroxed pieces of paper. Is that correct?
No, they came out well. By then I had some readers, so, you know, it told me that I was going to the right place. Okay, there was a lot of information in UCSF's considering what little was in any other place. And my first appointment, they said, yeah, you have bad cataracts. Eventually, you're going to need full corneal transplants. And we don't do that right away. We wait until you're really legally blind because the outcome is so bad. We put it off as long as possible. You're replacing your optics, the majority of it, with somebody else's optics. That's not a good thing. And they're subject to a lot of problems. Infection, they can be destroyed easily with a small blow. We said, well, could you do cataract surgery? And they said, yeah, but, it's kind of chancy and we don't think that way. Well, after 2 years of not being able to drive after that, my wife said, let's push them harder.
It's time for you to be able to see.
I'm tired of driving.
Right.
So we pushed them. And they said, well, there's an 80% chance of success. So we said, let's do it. And it worked out well. It was just what we needed.
So at the time, I know that with diseases like this, where the treatments, let's say, are advancing over time, and part of the reason they may have even asked you to, hey, delay it as long as possible, is the treatments invariably improve with time. At the time that you had the surgery, what year was it then?
My surgery was done in 2007 and 8. And by that time, what they call partial corneal transplants, where they just replace the offending layer of the cornea rather than the entire cornea, were somewhat along. It turned out that actually by forming the online group Fuchs Friends and getting the patients together, we also started communicating with the top surgeons, the experimenters, the people who really cared about what they were doing and kept trying to advance the state of the art. We had documentary evidence of the fact that we pushed this hard enough that it propagated through the community, the worldwide community, faster than any other ophthalmological improvement, because our members would talk to their specialist and he'd say, you need a transplant. They'd say, a partial transplant. He said, well, I'm not doing that. And they would say, well, we know people who are doing it. We're going to go there if you don't learn how to do it.
So you pushed from the bottom, essentially.
We pushed from the bottom, and that's been acknowledged.
I've learned a little bit about this just over the years of knowing you and doing my own research. The things that intrigue me most about where we have been and where we're going with the types of surgeries they're doing really have to do with the reduction in the invasiveness of the surgeries. Like back in the day in 98, what they were mostly doing was essentially stamping out that portion of your eye and putting in a new piece and stitching it all around, right? Where there was a lot of scarring, the outcomes weren't as good, rejections were high, infections were high. And then more recently, this, little incision on the side of the cornea, scraping out the old layers, putting in the donor. And now even advances going further where it looks like they're looking at injection possibilities. One of the questions I have for you, being that you've seen how far this technology has come in a relatively brief amount of time, what do you think it will be like for people in the future? Like, let's say one of my kids, your grandkids, ends up having Fuchs dystrophy. How do you think treatment will be then?
I go for a 6-monthly checkup at UCSF with the same surgeon. He's a researcher. My 15 minutes with him usually turns out to be a conference between he, Monica, my wife, and myself for an hour to an hour and a half. Okay. And the goal of the surgeons is to put themselves out of the business. The natural progression for the particular corneal dystrophy I have, if I had normal cells, they would last until I was 135 years old. Then I wouldn't have enough to maintain what it's supposed to do. Our cells die off faster, and they do not replicate after birth. The goal is to try to continue with healthy cells as long as possible to avoid surgery. That's what they're trying to do. And actually, there are a couple of intermediate steps after partial corneal transplant where they simply scrape away the diseased cells. Actually, they tear it off. It's a tiny layer, 1 cell thick. Then they wait for the cells from the periphery, which are healthy, to propagate into the center. Now, that only works for some percentage of people, and they're very strict about who they try this on. Okay. And it's called a big long name.
Yeah.
Okay.
DWEK, anyway, I get it. And then I've seen DMAC, I think is another acronym.
It's stripping without a donor tissue being inserted. That's one. There's clinical trials going on. There's probably 40 or 50 around the world of centers that are working on this. There's one in particular that has the highest record of anybody, and he's one of the high performers with partial transplants. It turns out people who excel all the time. They continue to amaze me. The second one is from a company called Trefoil or Trefoil, and it's something called a fibroblast growth factor that's naturally occurring in the cornea, and it aids in healing the cornea when there's trauma or incisions. They've re-engineered FGF1 to call it EFGF1. They put it in a solution, and they're running trials now where they give a series of 4 injections into the eye over a period of 4 weeks. It causes the cells to replicate. The problem with replication normally would be that the cells don't stop and they jumble up on top of one another, and that layer doesn't do what it's supposed to do. Then it defeats its purpose. Well, apparently they have a stopper in there that recognizes when it looks like a beehive, nice row of hexagonal cells all interlocked.
So like honeycomb, like a level of honeycomb.
Mm-hmm. The word I was reaching for.
Beehive, right. Exactly.
There actually are clinical trials. Now, we're encouraging our members to work with both companies that are doing this. The issue is that these are in clinical trials. They are either triple or quadruple blind, and that means that at least a portion of the people are going to get a placebo, which has no effect. In the Trefoil case, they are trying 3 different strengths of their product plus a placebo. So 1/4 are going to get a placebo. Mm-hmm. And we don't know who they are.
Well, that's better than half. I mean, a lot of them are done that way, so.
Yeah, well, the COA is testing with DSO or DWEC, and they're using something called K321, which is a ROCK inhibitor, mm-hmm. and it does good things when it's needed. Their ROCK inhibitor tends to encourage the cells to move from the periphery into the center. So when the cells are stripped, they are hoping that it improves that migration. Mm-hmm. However, COVID has caused a big problem. In international shipping, you're not allowed to ship into the U.S., number one, so they can't get that. It hasn't been approved officially for safety in the U.S. That's why they're doing trials. Okay, and we're encouraging people to go with that. But the big stopper is, again, that there's placebo. Some people don't want to try.
Understandably, they want treatment that's going to help them, right?
Yeah, the nature, it's interesting to watch the nature of the group change. Our group will really started out, and we try anything, okay, because there was nothing much out there. Almost anything could be better. We pushed on this stuff. It's difficult to get people to understand how delicate these operations are, how delicate manipulating the cells, the genetics are, and that they are so privileged to be able to get in on this stuff.
Right. So let's talk about that for a moment. About 2% of people over 40 will eventually be diagnosed with corneal dystrophy. Is that statistic still correct?
It depends on whose research you look at. I've seen everything from 2% to 5%. The other thing is of people over 40.
Right, of people over 40.
But fairly recent genetic analysis has, for instance, Fuchs dystrophy was considered to be maybe two variations. The normal late onset one, which goes up about age 50 and later, an early one. Well, it turns out that they found 8 loci, genetic loci, and they all seem to have different propagation levels in initiation dates, ages and stuff. It's much more diverse that way.
I think I remember seeing a story of a woman in her 20s that was diagnosed with corneal dystrophy, and just the shock that came with it, because nobody had ever spoken to her about this type of a disease. And it isn't something that's routinely even talked about at a medical office. Like when I went in for genetic testing myself when I was pregnant, as what they called geriatric mom, being in my late 30s at the time, the geneticist I spoke with wasn't even familiar with Fuchs dystrophy. So it's, I think it sits in it's the rare disease field. People who are in ophthalmology, they understand it, or they're gaining a better understanding with time. But 2% of a population over 40 sounds like a rather large number to me, even if it is a rare disease.
But you see, it's rare enough so that although every ophthalmologist learns about it while he's in school, prior to being a resident, they rarely ever see a case of it. And when they see a case, they don't know anything about it.
And they don't know what to do or what to recommend.
Right. They just haven't followed it. And very often what I hear is that they're not sure whether it's the cornea that's causing the issue or if it's a cataract.
Mm-hmm.
Well, if you can't see through the cornea, you can't see a cataract. Okay. So,
yeah.
And the cornea clouds, there are a number of markers for it. So I just think that they don't know what to do about it.
Well, I mean, you manage the Fuchs Friends group in particular to help patients navigate all of these challenges that they encounter when they get a diagnosis. I mean, I've seen some beautiful testimonials on your site and in social media. So I wondered if you could tell a story, one that perhaps stands out to you, of an individual that Fuchs Friends and your foundation has been able to help and support.
The story is a bit unusual. You talked about a 20-year-old. It's about 3 years ago, I got an email from the grandmother of a 5-day-old infant. My newly born grandson, 5 days old, has been diagnosed with corneal dystrophy. That rang an alarm bell right away, because when an infant is born, if it cannot see, it may never generate the pathways necessary to be able to see later. The infant has to see at birth or very close to birth. So there's a clock ticking on this thing. And this was a Saturday afternoon. I saw this. I emailed her, got some more information, but I didn't get the parent's name. She didn't give it to me. And I emailed a surgeon in the Midwest. I can't use names on this. They never gave permission. And
I understand.
They're very private people.
Right, of course.
I emailed the surgeon. He's been cooperative, helped me find people in Israel or surgeons in Israel and all over the world. And I figured I'd get an answer on Monday. About 40 minutes later, I got an email from the local university that was putting a team together to handle this baby. Then I got an email from the surgeon himself, and he said he was going to sit in on it too. And all they needed was the parents' permission. Well, it took me over a day to get the grandmother. I didn't have a phone number. She didn't give it to me, so I was working by email. Over a day to get her to contact the contact information for the mother. And I got immediate permission. Within a week, the child had a partial corneal transplant successfully. So I kept in touch, and he had another one at about 3 months, I think. And I checked at 1 year with Mom. He had also been diagnosed with glaucoma. They put a shunt in. It controlled the intraocular pressure. He was doing fine. At 2 years, she said, "Oh, I found out what the terrible twos mean." It's very normal, just bumbling around.
Right. So now the child has vision and they otherwise would have been blind.
Now the child is a normal child with 2 corneal transplants, and a shunt to shunt off excess pressure in one eye. Kids are amazingly adaptable.
Yeah. Well, they can definitely pick themselves up and keep running down the street, can't they?
Right. Most of the people that I have to deal with personally over the phone are freaked out. They lived all their life healthy. They cannot understand how they got this disease. They claim that nobody in the family ever had it. Well, as part of the previous generation, I can tell you that the generation prior to us, they didn't talk about what was not well in their life. So you didn't find out. Or it was aging. They thought it was just getting old eyes.
Yeah, they got old eyes. They couldn't see as well. They maybe had cataracts that impeded.
Cataracts were virtually inoperable on the generation prior to mine.
Yeah, it was just accepted as a fact of life. Like a dog got really old, they got cataracts and couldn't see anymore. Maybe that's it. Same thing with a human, right?
My mom had cataract surgery on one eye. She was in the hospital in a semi-private room in bed for a week.
Well, different world now, right? You like outpatient surgery, right?
Partial corneal transplants and full corneal transplants are outpatient surgery. And you go home in your car and you lay down, okay? And then you're up and down. That's the story that really sticks with me. We've had 3 or 4 cases with an infant, and we've had absolutely no trouble getting a specialist.
Yeah. I mean, I imagine they want to do it out of this kind of do-gooder center in their hearts, and it's something they could also put in their accolades book, right? People become medical doctors for a reason typically, and they want to help the young for sure.
But many of them cannot suffer fools. They won't take silly questions, okay? Mm-hmm. They will help as much as they can. Just don't waste their time, okay, because it's precious. The top doctors, top specialists all publish, do research. They take tons and tons of data points for every surgery that they do. They compare them. They look to see what works and what doesn't. And they constantly are working on improving the state of the art.
Yeah.
Okay. I'm amazed by these people. I tease them and call them data freaks, and they are. Because that's what makes them better. They can see what they've done.
I wonder if in running this particular not-for-profit, I mean, over the years, you've touched the lives of so many people and helped support them with Fuchs Friends, as well as through the Corneal Dystrophy Foundation. If you were to kind of give our audience a perspective on how you measured success as time went on, and perhaps how you measure that today, I think that would be helpful for any budding potential not-for-profit developers out there as well.
Success, to me, in this case, means that no matter what I do and no matter how much help I get, I have to help even more people and work harder because more come in. Success is people recognizing that you can help them and coming to you to do it, to get that help. The other thing is the recognition, not obvious recognition, but the attitude of the specialists, the top guns, that they have respect for what we're doing and they appreciate it. And they tell us that, okay? And they tell the public that. More and more what we're seeing is that they recommend that people join our group, Fuchs Friends. One of the reasons for starting the Corneal Dystrophy Foundation was to expand the scope to cover all corneal dystrophies, because there's over 20 of them. Fuchs Friends is also open to anybody with any corneal dystrophy. We don't have members for everyone, but we'll welcome people with them. There's a lot of commonality. The surgeons are recommending that their patients join Fuchs Friends.
Now, how people find Fuchs Friends, they can just go to the Corneal Dystrophy Foundation's website, and that's cornealdystrophyfoundation.org.
We have a navigation bar across the top, and on there it says support groups. And you can click on that and find out how to join.
There's a really simple pathway. So that website just again is cornealdystrophyfoundation.org, all spelled out. And if you type a search into Google, it comes up first because again, they've been around for quite some time now and are a resource specifically for patients who have corneal dystrophies. So you can find Fuchs Friends that way. And there's a variety of, groups on Facebook sometimes that even mention it or point to it. I've seen that myself. You can also connect with the Corneal Dystrophy Foundation through social platforms, Facebook, Instagram, LinkedIn, etc. I know, Bob, your goal is to be accessible to as many people who might be afflicted with this as possible around the globe. Recently, you were talking about an initiative producing potentially even an app or another technological piece that you could help support other communities with. Do you have an update for that, or is that still a little too new?
What the goal would be is to have a generalized app or web platform that can work for any rare disease, pattern it after what we do, where Fuchs Friends is actually a repository of knowledge. That was the goal. People can talk to each other by phone or by email, and they benefit from that, but nobody else does. So the goal was to store that information. So we kind of discourage one-on-one kind of conversations unless they're through the platform. This allows a body of knowledge to be accumulated. I hope to get into big data one of these days.
Step by step, right? Every day is a new day.
We've got over 200,000 conversations recorded, email conversations. Anyway, this is a generalized platform. The germ for it came from a woman in India who has two daughters who one is in the computer business in software and the other one is an architect. She couldn't find a surgeon and she joined Fuchs Friends, or the daughters joined for her. They've developed a big respect for what we're doing. So the one works for a firm in India that does apps and things. What we're doing currently is running a members survey. They gave us a lot of questions that they wanted answered in text form. I converted it to a survey. I built a process where every group of 150 people that I survey spreads across the entire 20 years. I've been getting a lot of answers. Not as many as I want, but a lot of answers that will be used as part of a guide to design a new system.
Yeah, well, that's incredible. I applaud that effort. I hope it goes smoothly and that you have an application the next time we're able to have you on.
Thank you.
Before we end the show, I'd love you to just perhaps give a few words of wisdom, any takeaway or soundbite that you'd like to leave the audience with.
Well, I'd like to focus it on your vision. Don't assume that a change in your vision is just normal aging. Never do that. Go to an expert and find out what the problem is, why it changed, okay? To modify that a little bit, an optometrist specializes in measuring your eyes. That really is their primary function. They do other tests as a way to refer you to an ophthalmologist who's an MD. First has to become an MD and resident in that, and then subspecialty in ophthalmology. You should really have a working relationship with one ophthalmologist and use him as a spring platform for any specialist. So that's really the two things. Don't underestimate what happens on your vision. Or you might end up going over a curb when you think it's a driveway, as I did. Mm-hmm. That was my wake-up call.
Well, don't hit any mailboxes, right? I want to thank you, Bob, for coming on the show. Now, reminding the listeners here, you go to cornealdystrophyfoundation.org. There you can research some more for yourself. You can join Fuchs Friends. You can even choose to donate. There are options to do so for one-time or revolving donations. It's a completely member-supported, really field. This isn't backed by any big company. So let me go ahead and thank you all for joining us. Bob, stick around for just a moment. Today, we invited you to care more about the rare genetic diseases in particular. So I have a question for you. What rare diseases affect you or those that you love? What support system is available for them? You can donate resources, or you can always volunteer, giving your skills and your time. Action doesn't have to be or feel like a Herculean effort. Your action could even be just sharing this podcast with people in your community or who might be afflicted with a rare disease. To find suggestions, you can visit caremorebebetter.com. There you'll find an action page dedicated to causes and companies we encourage you to support. And I invite all of you to join the conversation and be a part of this community. You can follow us on social spaces at caremorebebetter and message us directly here or on our website. Now remember, this podcast is not backed by any company, much like the Corneal Dystrophy Foundation. If you like what we're doing and can afford it, you can support the show by donating directly on our site, caremorebebetter.com. Thank you, listeners, for being a part of this pod and this community, because together we can do so much more.
Thanks for listening to Care More, Be Better, a podcast for social good. To make sure you never miss an episode, subscribe, rate, and review wherever you listen to podcasts, and share with your friends to help us reach more people and spread more social good.